Who is Professor Dr. Grace Ayensu-Danquah, U.S.-trained surgeon and new Deputy Health Minister? Imagine a healthcare landscape transformed by a visionary leader with a dual mission to heal and govern. This is precisely what Ghana's President John Dramani Mahama aimed for when he nominated Professor Dr. Grace Ayensu-Danquah as Deputy Minister of Health. But here's where it gets truly remarkable. She's not just any politician. She's a seasoned medical professional with a global footprint. As the Member of Parliament for Essikado-Ketan, Dr. Ayensu-Danquah is poised to bring her stellar credentials and humanitarian spirit to the forefront of Ghana's health initiatives. Dr. Ayensu-Danquah's journey to this pivotal role is nothing short of inspiring. Her appointment continues President Mahama's commitment to elevating the health sector by appointing experts to critical positions. This move comes at a crucial time, especially after the launch of the Ghana Medical Trust, affectionately known as Mahama Cares. The aim is clear: to enhance the quality of healthcare services and accessibility for all Ghanaians. What sets Dr. Ayensu-Danquah apart is her diverse background that spans continents and disciplines. As the first-time MP, she has already made waves with her expertise. Board-certified in general surgery, she has undergone advanced fellowship training in trauma, burns, and reconstructive surgery. Her academic achievements are equally impressive, with medical degrees from prestigious institutions such as the University of Wisconsin-Madison and the University of Southern California, and a Master of Public Health from Johns Hopkins University, all in the United States. Moreover, Dr. Ayensu-Danquah holds active medical licenses in California, Michigan, and Maryland, showcasing her commitment to staying current with global medical standards. Back in Ghana, she operates a private surgical facility in Accra and teaches as an adjunct professor of surgery at the University of Utah's Center for Global Surgery. These roles underscore her dedication to both clinical practice and education. But her impact extends beyond the confines of hospitals and classrooms. Dr. Ayensu-Danquah is the driving force behind the Healing Hands organization, a non-governmental organization dedicated to providing free surgical and medical care to underserved communities. This initiative not only addresses immediate health needs, but also equips rural health facilities with essential medical equipment, significantly improving healthcare outcomes in remote areas. Her commitment to public health governance is further evident through her roles on various committees and boards. She serves on the Technical Advisory Committee on the Safety of Vaccines and Biological Products of Ghana's Food and Drugs Authority and is a board member of Days for Girls International Ghana. These positions highlight her proactive approach to tackling public health challenges at multiple levels. Dr. Ayensu-Danquah's professional recognition is another testament to her excellence. She is a fellow of several esteemed medical colleges, including the Ghana College of Physicians and Surgeons, the American College of Surgeons, the International College of Surgeons, and the West African College of Surgeons. Her inclusion in these prestigious organizations underscores her contributions to the field of surgery. In a world where expertise and passion are increasingly vital, Dr. Grace Ayensu-Danquah stands out as a beacon of hope for Ghana's healthcare system. Her appointment as Deputy Minister of Health promises to bring fresh perspectives and innovative solutions to the table. And this is the part most people miss. Her story is not just about a political appointment. It's about the intersection of medicine and governance, working together to improve the lives of millions. What do you think? How can we ensure that such appointments continue to drive positive change in our healthcare systems? Live-streamed vetting. Prof. Dr. Grace Ayensu-Danquah for Deputy Health Minister. In a significant moment for Ghana's healthcare landscape, Professor Dr. Grace Ayensu-Danquah, the esteemed Member of Parliament for Essikado-Ketan, is set to appear before the Parliament's Appointments Committee on Friday, July 25, 2025. This session will serve as her vetting for the position of Deputy Minister of Health, a role that carries immense responsibility and potential for impactful change. During this crucial meeting, Professor Dr. Ayensu-Danquah is anticipated to share her vision and strategic priorities aimed at bolstering the primary healthcare system in Ghana. Her focus will likely include initiatives to improve the doctor-to-patient ratios, which is a pressing issue in the country, as well as enhancing services for maternal and child health, areas that are vital for the well-being of families across the nation. What sets Professor Dr. Ayensu-Danquah apart is her extensive background in both clinical practice and humanitarian efforts. As a trained surgeon and a passionate advocate for global health, she brings a wealth of experience that could greatly benefit the health sector in Ghana. Her nomination is part of President John Mahama's final set of deputy ministerial appointments, reflecting his commitment to establishing a streamlined yet effective government. But here's where it gets controversial. Will her proposed changes be enough to address the deep-rooted challenges facing Ghana's healthcare system? Many citizens are eager to see tangible improvements, yet some skeptics question whether any new appointee can truly make a difference in such a complex environment. What do you think? Are you optimistic about the potential changes she might bring? Or do you believe the system is too entrenched for any real progress? Share your thoughts in the comments. Afenyo-Markin apologizes to Dr. Ayensu-Danquah in parliamentary move. Afenyo-Markin's apology, a step towards unity. In a surprising turn of events, Alexander Afenyo-Markin, the minority leader, has issued a public apology to Dr. Grace Ayensu-Danquah, who is the Deputy Minister Designate for Health. This apology comes in the wake of controversial remarks he made during a parliamentary debate that ignited significant backlash. During the debate, Afenyo-Markin raised questions regarding the reasons behind Dr. Ayensu-Danquah's nomination for the Deputy Minister of Health position. His comments insinuated that her appointment was based on strange reasons and hinted at favoritism towards her over other female members of Parliament, such as Dr. Zanitor Agemanterium Rawlings. This line of questioning was met with widespread criticism, as many viewed it as dismissive and undermining to the role of women in Parliament. The public and fellow legislators expressed strong disapproval of his statements. On July 25th, while appearing before the Appointments Committee of Parliament, Afenyo-Markin took the opportunity to express his regret for his earlier comments. He stated, "I want to say to you that to the extent that as a colleague we relate very formally, informal, and at that moment, unbeknownst to me, you felt I had crossed the red line, I say to you I'm sorry. Is that fair?" His words reflect a recognition of the impact his comments had on his colleague and the broader implications for women in leadership roles. Dr. Ayensu-Danquah responded to the apology with grace, saying, "That is fair, and I'm very appreciative that you have taken this opportunity to apologize. And I hope that moving forward, we will have a better relationship. I'm very grateful and humbled. Thank you." This exchange highlights the importance of accountability and the potential for healing and collaboration in the political arena. What's next? This incident raises important questions about the treatment of women in politics and the need for respectful discourse. How can we ensure that all voices are valued equally in the political landscape? What steps can be taken to foster a more inclusive environment for women in leadership? Join the conversation. We invite you to share your thoughts on this matter. Do you believe Afenyo-Markin's apology was sufficient? What more can be done to support women in politics? Let us know in the comments.